exercises. It could be a kitchen utensil, a pen, anything, and go ahead and show it to us.
So what I have my patients do to help strengthen these muscles to help us focus are we look at the tip of the pen, count to about 3 to 5, then we focus on an object in the distance.
Okay.
Find something, look out the window, or if you're in home, look for something, maybe 20 feet away. Look, then look back at your pen. Then look far away, then look close. What this does is it helps flex the muscles and exercise the muscles, which help us to focus.
Before we get started, I want to tell a personal story about my mom and Lifeline screening. You may have heard me talk about my mom's peripheral arterial disease diagnosis about 5-10 years ago. And I wanted to let you guys know how we found out about it. She's not a doctor-y kind of girl, and she has white coat syndrome. So it was very challenging for us to get her tested for different cardiac issues. So I got a postcard in the mail about Lifeline screening, and I went ahead and contacted them and brought her to basically like a pop-up, which was at a church, a local church. And she went in, and it was very quick and easy. She didn't seem to be super nervous about it. There were a lot of people milling around, and they found the peripheral arterial disease, sent us a report. We went to the cardiologist, started using diet and nutrition and exercise therapy to treat it. And I've since gone to the Lifeline screenings myself, as well as my other family members, because it was super cost effective, keeping us from having to pay multiple copays and travel time and things like that. So Lifeline screening is offering 5 preventive health screenings for a special price for my audience of $149. The package includes a carotid artery screening, abdominal aortic aneurysm screening, atrial fibrillation, which is also called AFib screening, peripheral arterial disease, PAD, which is what my mom was screened for, and osteoporosis screening. In addition, you can add other options like liver and kidney function and the A1C marker, which is for diabetes. So I can't encourage you enough to check it out. It's well worth it. It's going to save you a lot of time. It's painless. And you can click on my show notes in order to get the offer for $149, or you can call 844-558-0996 to schedule your appointment. That's 844-558-0996. Hello, everyone, and welcome to A Modern Healer's Journey. This is a YouTube show about health and wellness and all aspects of modern medicine, traditional medicine, everything in between. And my name is Tammy Bennett. I'm a doctor of Oriental Medicine here in Orlando, Florida. And I am very pleased to welcome Dr. Andy Rosenfarb to the show. He is working with people that have vision problems. I will let him introduce his credentials so that I don't mess that up. So Dr. Rosenfarb, tell us about who you are and your credentials.
Hey, Tammy, thanks so much. It's great to be with you.
Absolutely.
So I, like you are a doctor I went to acupuncture school. That was my first training. Received my Master of Traditional Oriental Medicine back in 1997. Then I went on, I have a naturopathic degree, Doctor of Naturopathy degree that I got in early 2002. And more recently, over COVID, I finished up my doctoral program. So I got the DTCM credential as well. So also national board certified in Chinese herbology and acupuncture. I practice functional medicine as well. So a lot of stuff.
Yeah, for sure. So tell me about your realization about traditional Chinese medicine and its ability to be successful for eye conditions, because I'll be honest with you, I had no idea the depth and breadth being a TCM practitioner myself. And when I heard about you through some friends here in Orlando and clients that know you and your work, I was blown away by the depth and breadth of what you've accomplished. So how did it all start, and how did you become excited about that?
It's a great question. So like you, when I was in acupuncture school, I think I had 3 sides of notes for all eye conditions. It just wasn't really taught very well. There's a couple, as you know, in like some of our texts, like the Shanghai texts or the Giovanni, there was a little bit of information, but every condition was like, liver, kidney insufficiency, the Chinese medical jargon like that. But nothing. There was like a little bit on glaucoma. That was pretty much it. So fast forward, when I started to practice, I had a couple of patients with glaucoma. And my mother actually was diagnosed with glaucoma, early stage glaucoma, or glaucoma suspect, as they call it, when I was in acupuncture school. So I started to have an interest in that. I was asking some of our professors and teachers, like, what was there available? And nobody really had anything. It was just like, and it was kind of understood or in school that you just didn't treat eye issues, like hearing issues as well. It was just like, yeah, there's just not too much we can do about that. I didn't believe them. So I was kind of like, all right, well, I don't understand that logic. If I can help women with PMS, if I could help an athlete with rotator cuff shoulder injury, if somebody's had a stroke and I could help with rehabilitation, if I could help people with fertility, anxiety, asthma, why was ophthalmic conditions so different? Like, just questioning that idea. So the more I thought about it, the more I started to look and see what I could find in Chinese medicine at the time in terms of what was available. And there really wasn't a whole heck of a lot. So that kind of put me on, I guess, a vision quest
No pun
to
intended.
find more. Right, about what did Chinese medicine have? We know this, over 2,500 years of empirical study and research. So I started combing through a lot of the classics, a lot of the different books to see anything I could find on herbs or references or lifestyle or anything that had to do with night blindness or glaucoma or any form of vision loss. And I found just that, like little bits and pieces of references and understanding. So ultimately, I went to China. I studied in China for a few months, and there were a couple of hospitals there that had been doing work with patients with eye issues, but not much. Most of it was like glaucoma and eye stroke or brain stroke that affected their vision. But there really wasn't a whole heck of a lot for patients with like macular degeneration, glaucoma, eye strokes, optic nerve issues, so on and so forth. So I found there were some practitioners in Europe, interestingly enough, Germany, other countries, Switzerland, Denmark, a couple of countries out there where people had some experience and had some new microsystems that they were using. So I went out to Europe and started studying with them after going to China and seeing that they were using a lot of electrotherapies for eye conditions. And it just, the more I learned, the more interested I got. And the more I started gathering information, I started getting good results, and other practitioners would reach out to me. And after that, I was like, well, maybe I should just write a book on this to try to get it out there. And then started to teach and so on and so forth. So it kind of evolved just from this base of knowledge that I created after identifying that was really just a void in our profession that needed to be filled.
Got it. So you compiled all these bits of data. You studied with some people that had some fundamental background that they could share some knowledge with you. I know from past history, talking with other people that have traveled to China, that there was a lot of withholding of information from the Chinese practitioners to the American practitioners, almost like a if you're not in the club, you're not in the club kind of thing. I'm sure you had to do a lot of work of that on your own. So when was the moment that you realized you had the ability to help someone and you decided to run with that? Did you have a specific patient? Like for me, I've always been driven to research by a specific patient. So I've got a patient right now that's got Charcot-Tooth-Marie syndrome, which a lot of people don't know what CMT is. I've seen a dozen or so in 25 years, which is a very small amount. But I did all the research early on because I had that one client that really needed my help, and that sent me on the journey. So was that the same for you, that one client that you helped?
Exactly what happened. So I had the interest, but it was this, I've told the story a couple times. This is this client, his name was Manny, right? He had pretty advanced glaucoma. He was from Brooklyn, tough, really SOB Jewish guy who just had a lot of attitude. And he told me, he's like, look, you're nobody's going to help me. You're going to help me. And I'm like, a year and a half out of school, like,
Right.
what do you mean? But as you said, his stand for me to be able to help him really lit a fire under my rear end. It's like, man, this guy believes in me. Like, I don't even believe in me yet. I'm only practicing a year and a half, So he was like, no, you can do this and you're going to help me. You're going to find out how to use acupuncture and Chinese medicine so that I don't go blind, because I'm already half blind. And he had a wife that was disabled. He's like, I got to take care of my wife. I got to take care of my business. He was in his high 70s. He's like, I still got a life to live. So yeah, it was Manny who just really called me out in a good way and called me to a higher level of this playing field and saying, look, this is non-negotiable. Like, you have to figure out how to help me.
Yeah.
So he was like sending me articles and calling, and he was calling some of these practitioners in Europe, calling them, because I'm dating myself, because before we had, frequent use of the internet and email and stuff like that. Nobody was using it that much. So he's calling Europe like, oh, I have a guy who's going to come out to you. He's going to reach out to you. You need to help him because it has to help me, and blah, blah, blah. So his persistence and his extreme dedication really set me on this course.
So was it the acupuncture? Was it the electrostim? Was it the herbs? Or was it the sweet spot combination of all those things together that made you see the difference in people's vision?
Great question. It was a lot of trial and error. So some of the systems I learned didn't work. The reason I went on this quest to find is because I tried the protocols. I tried the gallbladder 20 and the Tai Yang and the liver 3 and the LI 4 points, and the prescriptions, the point prescriptions, I just wasn't seeing the results.
Right.
So looking at the idea again was that premise that it has to help. We just have to find the right points and the right acupuncture systems. So that was my first goal. And I was also very into herbs. So I did a lot of research at the time, and Qigong. I was very, very passionate about Qigong when I first started as well. So it was a matter of finding which systems, they're all systems. All the systems, acupuncture systems, are great and have tremendous value. But as we know, some systems work better for certain conditions. So my goal was to go through the systems and find out, of all the systems I could come across, which ones were going to get the best results with acupuncture to help improve people's vision. And the reason I focused on acupuncture is because that's really what people come for. Sure. People are like, we're coming to you for acupuncture. So that was really the foundation. And then I kind of built out the herbs, the functional medicine, the adjunctive therapies, the laser acupuncture, the hyperbarics, the alternate, all the other therapies. We use supplements around that. So it really started with acupuncture as a foundation, and that belief system and mindset that acupuncture was going to work, even though I didn't know how.
Do you find that people ignore the early signs of eye degeneration and just kind of slough it off like, I'm getting older, therefore, I'm just resigned to have this problem?
The majority do. And the reason for that is a couple of things. So if you go to the eye doctor, for example, and you're told that you have early stage glaucoma or macular degeneration, you might leave not really knowing what that is, depending on the tone of the eye doctor you're seeing. Like, some of them could be freaking out, and they may freak you out. Like, so you're going to go blind, very matter of fact. You're like, what? Right. Excuse me? Like, come again? Or they're just like, yeah, oh, you have macular degeneration, early stages. And people just leave, and they go home and, Dr. Google, and they're like, like total freak out. And they're like, I'm going to go blind. Oh my God, what? So they start freaking out. So there's that side of it. That the doctors will drop a diagnosis or what's going on, and they'll either be hyperreactive or hyporeactive, meaning they won't really give information or talk too much about it. And patients are left, the majority of patients who aren't really talk too much about it, who aren't doing their self-education, are like, okay, doctor didn't make a big deal out of it, so I don't make a big deal out of it. And they said there's no treatment, so don't even bother, so there's nothing to do.
Well, that
The
was
doctors will tell people that.
yeah, that was my next question. Is there anything that they're offering, or is it just and I'm speaking to you from someone who has had very little eye problems in her lifetime.
Yep.
And I knock
Yep.
on wood and thank the good Lord every day that I have had very few problems. My mom has had a myriad of problems. She's one of your long distance patients being treated
Yeah.
with your supplements and your protocol.
Yeah.
And I'm really lucky. So is there something I mean, I realize people get glasses and they get cataract surgery, but for
Yeah.
degen, wet and dry, and we'll talk about that in a minute,
Mhm.
and for glaucoma, is there anything?
Yeah. So some conditions, there are biomedical treatments. Glaucoma is the most, other than cataracts, it's the most aggressively treated condition. So there's trabeculectomies and surgeries and iridotomies to lower the eye pressure. There's also eye drops that are going to lower the eye pressure. The entire treatment for glaucoma for people is based solely in 100% on controlling eye pressure. Even if patients don't have high eye pressure, which is called normal tension glaucoma, they still give them eye drops or treatments to lower the eye pressure because that's all the glaucoma specialists, ophthalmologists know how to do. So we know that that's not enough because people with controlled eye pressure will continue to lose vision. So to answer your question, yes, for glaucoma as an example, there is treatment, but it's not good enough because people with controlled eye pressure, whether it's surgery or eye drops to lower the pressure, are still going blind. And the doctors are like, it happens. Sorry, you're old or you have bad genes.
Right.
Same with dry macular degeneration. Wet macular degeneration, you can get injections that'll help control the bleeding. However, there is scar tissue, inflammatory, and potential damaging effects of getting the injections. And it doesn't deal with the underlying issue that's driving the macular degeneration. So it gives people, these treatments will give people a false sense of hope and comfort that they're actually going to be okay when in fact it's not. So we need this integrative model to really deal with both, as you know, the root and the branch, the cause, what's driving this, plus the actual vision loss.
So give me a couple pearls of wisdom for the audience about early signs of eye issues that they need to address. So let's talk about glaucoma first. Is it just pain?
Yeah.
Initially, a lot of people don't get glaucoma screening. They don't get the little poof in the eye. So what would be a layperson's trigger to think, I should probably go get my eyes checked for glaucoma?
Yep. So first and foremost with glaucoma, it's called the silent thief of the night. And why do we call it that? Is because you don't know it's coming. And the visual fields can start to go little. It's like the frog boiling idea. Like it's so subtle and so gradual, your visual fields will start to narrow. You don't even realize it. If it hits if the optic nerve starts to degenerate and affects the nerve fibers that communicate from your central vision, you'll be more aware of it because things are going to look a little, you're trying to read, it's a little blurry. If there's a family history, absolutely. If you can get a headache. Here's what I've noticed. Patients who have what's called angle closure, which is a medical emergency, when they lay down, it hurts so bad. And then they sit up and their vision. I had this actually patient in clinic about 7 years ago. I actually sent out to the emergency room. So it was an old patient I was dealing with who had arthritis and she was trying a new steroid. And she came in, I've been working with her for years. She laid down on the table, was like, oh, my eyes, I have such a headache. And I was like, wow, you didn't have it a minute ago. I was like, sit up for me. She sat up. She's like, it's gone. It's like, all right, lay back down. We did that 2 more times. And I was like, oh, we have eye pressure equipment in the back. I was like, go get, come here. I was like, we got to check your eye pressure. And she was like 40 something. Normal eye pressure is under 20. So I was like, you got to go right now. So it turned out that she did have a little bit of an optic nerve. She lost a little bit of vision, but those types of things happen. You know, she just thought it was a migraine. She's like, oh yeah, I get these headaches sometimes from the inflammation, from arthritis, autoimmune. And the steroids that she was taking had caused eye pressure to rise, which it can in many cases. So certain medications can do it, family history, but general open angle primary open-angle glaucoma, most people aren't going to notice it. You may notice night vision, you may notice your upper vision or lower vision starts to go, but that's it. The best defense is just going annually to get checked to make sure that your pressure's okay, especially if there's a family history, especially if you're on steroids and or if you have head trauma or anything like that, and you notice anything that just doesn't seem right.
Gotcha. And for macular degeneration, both wet and dry, if you want to distinguish between the two, and then any pearls of wisdom on early signs and symptoms that can be, if you go early and you get treated, the better outcome.
Yeah. So macular degeneration is so let's talk about the retina first. So the retina is the back of our eye, the nerve layer of our eye. The easy way to understand that is if you ever cut a tennis ball in half, the black rubber on the inside, how it lines the tennis ball, that's kind of how the retina lines the back of the eye. It's a nerve layer. It's made up of two types of photoreceptor cells, rods and cones. The rod cells are in the more peripheral vision. They're more used for contrast in night vision in grayscales. The macula is in the fovea, which is the highest concentration of cone cells, which are used for color vision and a really sharp, fine HD vision that allows us to read and see fine detail. So that part of the eye is what we use for reading in most of our daily life. So that area can start to accumulate metabolic waste called drusen. It's pretty much cholesterol, fat with some protein, a little bit of calcium that builds up in the eye. Now, it's thought that this is an ocular waste product. So the body is just not getting rid of, it's like kind of eye constipation, if you will. The body, the part of the eye called the Bruch's membrane is not breaking down and getting rid of this metabolic waste, this fat deposit. So they start to accumulate, and we call that drusen. So that's how macula, in that accumulation of fat, similar to how cholesterol can congest the heart, or how amyloid plaques with Alzheimer's can clog the brain up and the nerve pathways. So it's the same idea of cardiovascular disease, just it's in the eye. It's like an ocular vascular disease. So that's dry macular degeneration, where the drusen will increase and ultimately affect your central vision, your ability to see, recognize faces. Early onset, you'll start to see things are wavy, maybe some spots. It's just like off. Your vision is kind of off and disturbed, and it's just not clear. Usually wavy lines or areas that are missing are the first things that people notice. So that's dry macular degeneration.
Okay.
Wet macular degeneration occurs where there is such a deprivation because of this drusen. One of the things that happens is there's a lack of blood flow because of all the cholesterol, like you have a heart attack, right? The cholesterol builds up around the heart, reduces the blood flow. Same thing happens with macular degeneration. We have reduced blood flow and ultimately a state of hypoxia where the retinal cells are suffocating. They're not breathing. The cellular respiration starts to fail. And because of that, the retina will start to degenerate, and the body, in its amazing ubiquitous wisdom, will start to grow new blood vessels to the retina and the macula to feed it oxygen and food so that it can repair and regenerate. So with wet macular degeneration, when the body grows these new blood vessels to feed the retina, which is the highest oxygen-consuming tissue in the whole body, these new blood vessels are very, very weak and fragile. The main blood vessels are like PVC piping. They're very strong, very durable. The new blood vessels, called angiogenesis or neovascularization, they're very thin and very weak and very brittle. So if you catch a cold, you drink too much alcohol, you get like a migraine headache, you get in an accident, a minor head trauma, they could pop and rupture. And that's what wet macular degeneration is. And the cleanup for that used to be laser surgery, but then they came out with these anti-VEGF injection medications, which will help sop up and dry up the bleed.
And is my understanding is wet mac is better to have than dry mac. Is that right?
No. The only reason, the reason they would say wet mac is better is because there's a quote unquote treatment. for wet, which is the injections. So the story on that is it's better to, some would say, I wouldn't say it, it's better to have wet macular degeneration because it's treatable, but it's really not. All they're treating is the bleeding. Dry macular degeneration, let me back up. So wet macular degeneration is always an advancement of dry macular degeneration. You can't have wet macular degeneration without having dry macular degeneration first because of the obstructive nature and the need for the body to create these new blood vessels, if that makes sense.
Yep. Makes sense.
So, but again, they have no treatment. You know, they have what's called the ARIDS study, which is using vitamin A, C, E, zinc, and selenium. That's all they have. They have OcuGuard, Preservision by Bausch and Lomb, and they're not the greatest supplements, but that's all they got. They say, well, you know, we don't really have anything. Take these vitamin A, C, E, zinc, and selenium, and, you know, via con Dios.
And lutein and zeaxanthin come on the scene?
Yeah, for sure. Comes on the scene. So the thing with that is we have like vitamin A, lutein, zeaxanthin, mesozeaxanthin, astaxanthin, leafy green vegetables, carrots, squash, pumpkin. Now, all these things are told to us that they're good for the vision, right? They're healthy for our eyes. And what the common denominator with all those is a nutrient called carotenoid antioxidants. Carotenoids, root word coming from carrots. Now, these vital nutrients are protective of the retina and the macula. They protect our eyes against UV radiation, oxidative stress from UV radiation, and blue light. UV radiation coming from the sun, we know, and blue light comes from the sun too, but most of the blue light comes from
cell phone.
Screens, cell phones, laptops, tablets, televisions, flat screen TVs. Anybody ever use screens? Ever?
Nah,
everybody. How about everybody?
Right.
Kids. You know, my kids are on their, I got 3 boys, the teenagers, and my 12-year, they're on the phone all the time. So the carotenoid antioxidants will protect against UV radiation and blue light from screens.
How do you
very, very, very important.
Yeah. How do you feel about blue light screen protectors, the blue light protection that you can click on the phone? Are you supportive of those?
Oh, yeah.
Okay.
Absolutely. So they'll basically turn your phone like yellowish. Great.
Okay.
It's not enough though. Here's a rule in my house with my boys. If you're spending more than 10 to 15 minutes on your phone playing video games, like they play Xbox and they're on their tablets or they're on, you know, doing homework, they have to get blue light glasses on. So we go on Amazon or whatever. And what I like to see is, so my oldest son's in college and my second oldest is in high school. And now I'm starting to see a lot of the kids who are wearing clear glasses, prescription-free glasses with blue light filters.
Yeah.
So wherever they're getting educated, they're getting it from somewhere, whether it's the optometrist or in school or their parents, whatever. So like, you know, bravo to whoever's helping them with that. But I'm seeing a lot more of that. And it is so important because, again, heavy continued ongoing blue light exposure will definitely stress out the retina, specifically the macula, and people who don't take carotenoid antioxidants or use blue light protection and are using screens so much are going to have to possibly battle a lot earlier in life with macular degeneration because these screens are 15 years old?
Right.
You know, tablets are 10 years old. We had flip phones like 10, 15 years ago, but it's only 10 years. So our biology has not caught up with the technology yet.
Understood. So do you find that there's some controversy within the eye care industry, ophthalmology, eye surgeons, and or physicians that treat eye conditions, whereby invasive procedures are recommended too often? Is that something that you see?
Yeah. So I can only speak to my concerns. I'm sure all eye doctors have their concerns. And keep in mind, too, I give lectures to my patients, and we were talking about this yesterday. So all medicine, in this case, we'll talk specifically about ophthalmology, retinal specialists, and glaucoma specialists. They all operate inside a standard of care, a box. So they don't deviate from that. And for this reason, 100 years when a physician graduated med school, the first rule was do no harm, right? And help your patient, obviously. Now it's shift to CYA. So, cover your rear end. So they have to deal with like, hey, anything that I don't really know about or that's questionable, I'm not recommending whether it works or not, because I'm not putting my license on the line, because if something bad happens, I'm liable.
Right.
So that's the first, put in their defense. But yeah, I mean, things like glaucoma surgeries, we talked about that earlier. It's too much, especially with glaucoma surgeries. They're too much, too often, too frequent, often barbaric. They're just chopping people's eyes up just to manage the pressure but it's okay for them to go blind.
Right.
Like, I don't care if you go blind as long as your pressure's okay.
Yeah.
Cataract surgery is another problem that I've only recently started to have a problem with. Cataract surgery is one of the most successful procedures ever done. It's one of the greatest medical miracles that we've had. It's helped hundreds, millions and millions of people over the last, 100 years or so. What's going on now is, so cataract surgery, the lens of the eye oxidizes and dries out, and you basically go from getting a clear window to a dirty window. So the procedure is they take it out and they put a clear window in so you can see. Things will start to get blurry. You get cataracts if you feel like you have to clean your glasses and they don't clean, or you go outside and you have a lot of sun glare, and your doctor will most likely tell you, your eye doctor will tell you if they see cataracts. Now, what they're doing now is they're putting prescription implants, like permanent contact lenses in. Often one near and one far, right? Because most people over 40 or 45 have issues with both near and far. Like I grew up with myopia, so I always had glasses and contacts for distance. Now, I'm 51 now, around 46, I started having some issues, seeing up close, like a lot of people do. So for those people, what they're doing now is they're giving one contact for near and one contact for far. It's called monovision, and people's brains can't really handle that. They're getting nauseous, or they're giving correction for distance or correction for up close without telling patients they're doing that. And guess what? Your prescription changes quite often.
Right.
So my recommendation for people who are getting cataract, and there's a money thing behind that. There's a significant amount more money for doing the prescription cataract surgeries. So I'm not saying I'm against it. What I'm against is the cataract surgeons who are not disclosing to their patients what this is. Like, I would tell patients who want to do that, get a pair of contact lenses first. Make sure you can deal with the one near, one far, or get contact lenses and get used to having clear vision and wearing readers. But before you permanently do that, try it with a disposable lens first to make sure that your brain is going to be okay with it.
Can cataracts be treated naturally if you catch it early enough?
It's such a great question. Yes, they can. Acupuncture can help. Certain antioxidants like glutathione, NAC is very good with that. We use a product called Can-C eye drops, which are N-acetylcarnosine eye drops, which basically are a precursor to glutathione. And what they do is they help with the oxidative stress that drives cataract. So early stage, I have actually shocked, but I actually had a couple of cases that were reversed, where patients were early stage, they call it baby cataracts, where they came in and I had them on these drops for 3 months, which is supposed to slow down cataracts. And they came back and they're like, yeah, cataracts are gone. Late stage cataracts definitely need surgery.
Okay. Yeah, I have, I've had very old pets, dogs, and they're, 16, 17, 18, 19 years old. And inevitably they all end up with cataracts. And I talked to a veterinarian, an ophthalmology specialist veterinarian years ago. And is there anything I can do early on to the younger dogs to prevent problems? And he said he recommended a homeopathic cataract drop for the dogs. Yeah. And I've, knock on wood, had some really good success with that as long as it's caught early. There was no helping.
100%.
It was late.
Yeah. The analogy with cataracts, it's like a hard-boiled egg. Like, once it gets going and the egg's boiled, like, you can't unboil it.
Gotcha.
So that's a late-stage cataracts. But yeah, absolutely. I have dogs too, so we use them on pets. We'll give them, like, when they start aging, we'll put them in, like, NAC supplements. And if we can, depending on the dog, we'll get the drops, in their eyes. Sometimes you could do that if they're, like, good boys or girls.
Right.
Will sit for you.
Yeah, I've had
but
that
yeah,
won't let me go near them. But the one that's letting me go near her, she's doing quite well. So we talked a little bit about the MAC-Degen, the wet dry. Can you speak to dry eye syndrome and
Yeah.
how different people have different needs for dry eyes? More importantly, I wanted to let you know that my mom, who has dry eye syndrome, which is how I got a hold of you to chat with about her condition, is doing remarkably well with what you said was a fatty acid problem, not a moisture problem. So tell me about that.
All right. So first and foremost, I will say that dry eye is, of all the eye conditions I treat, the fastest and most responsive of any ophthalmic condition. Like, it's amazing. And to that, it's the most frustrating for optometrists. All they have is like Restasis and eye drops like that,
Right.
which don't always work. They're incredibly expensive. They're about $2,000 a month. Yes, insurance pays, but it's still $2,000 a month. So here's the thing with dry eyes, and this is why we're so successful at this, is because I'm preaching to the choir. So the ophthalmic community, optometrists or optometrists and ophthalmologists will basically give patients eye drops, aqueous base, which is water-based eye drops. Tear film is made of 3 components: water, mucus, and lipid or fat. Okay, all they're doing is externally dealing with they give you an aqueous solution, which is a water-based eye drop.
Right.
Now, if you have dry skin, like some people do in the winter or whatever, occasionally get dry skin, do you jump in the shower?
No.
No. You use lotion. If you have chapped lips, do you put water on your mouth? No. Do you hose your mouth? No, you don't. Use chapstick, which is fat-based, or a lip balm. Same thing with skin. Back, 300 years ago, they were using like olive oil or coconut oil or jojoba oils. Now we have lotions, but they're all fat-based to lock in the moisture. So when we're dealing with dry eye, the first thing we want to look is, as we do so well with Chinese medicine, is look for lifestyle and patterns. Like, what's causing it? Like, are you drinking too much coffee and they're causing diuretics? You're drinking too much green tea, too many energy drinks. Are you putting things in your body that's dehydrated? Are you on a diuretic? You have a heart problem or something, or you have a problem urinating and there's diuretic. So what medicines, what lifestyle things are you doing that are driving your dry eyes? Also, are there nutritional deficiencies? Are you dehydrated? Are you drinking enough water? Do you have sufficient electrolytes, specifically magnesium and potassium, that act to hold the moisture in the body? So looking at the water layer first, what's your water intake? And is your body holding water? And are you getting rid of water too fast? So that's like the water side. Mucus side is, do you live on Mucinex? Are you constantly like dealing with stuff like that that's drying up your mucous membranes? You have dry nose, dry mouth, you got ear infection, taking things that are reducing mucus production in the body. That's usually a quick one. Then we go to oils and fats. Are you taking cholesterol medication that is drying up your fats? Are you on a fat-free diet, to lose weight? Do you have your gallbladder taken out, where your body can't break down and metabolize fats? Does your pancreas not work, so you're not secreting lipase, pancreatic enzymes to break fat down? Do you eat too many junky fatty foods and not enough good fatty foods? So taking like fish oils or coconut oil or olive oil to systemically increase your fat levels. So that's systemic. Then locally, same thing. You're putting the eye drops in, they're not working. But I found that most of the dry eye conditions are not a result of insufficient water part, but it's actually the oil. And the tears are evaporating too fast because the oil film that's at the top of the tear layer that keeps the tears in the eyes is insufficient. So our eye drops that we use, called the lipovision drops, you can either put in your eye or around your eye, and it'll actually seep into your eye. That creates this barrier, this oil barrier that keeps the fluids inside. The last thing we want to go ahead.
I was going to say just a quick thing. I had a patient years ago. She's in her, I would say, mid-80s, and she spent a lot of time in the rainforest doing a lot of work with indigenous peoples. And she used to put coconut oil over her eyes and let it just gently seep in. And I thought, don't you get a weird film on your eyes? And she said, no, it's very nourishing to my eyes.
Yeah.
She said she learned it from the indigenous peoples there.
Yep. So that's what we did. So our drops are pretty much castor oil, coconut oil, and sesame oil. We have a proprietary blend of how the ratio that I played with for like a bunch of years. So that I found works best. So for some people, if you put the drops in the eye, which we recommend for some patients with extreme dry eye at night, because yes, it will make your vision blurry.
Yeah.
If people have a problem with that, then we have them just put a drop on their fingers and massage it in their eyes, just like they would put chapstick around their mouth.
Yeah.
So that may take a little longer, but it'll work. And you got to look at other things like other hormonal imbalances, like women going through menopause often experience dry eye. Are there other inflammatory processes going on, like infections, autoimmune processes, allergies? So again, in Chinese medicine, in functional medicine, we look at the underlying causes, we deal with that. So you're gonna deal with the underlying cause. We're dealing with the branch itself, the dry eye, but we're also understanding the root cause that optometrists are not looking at and they're not dealing with. And we are.
Yeah.
So that's how we get such great results.
Understood completely. This has been fascinating. I want to wrap up with one question. It may lead down another road. We'll have you come back again if it does.
Yeah.
What exactly are eye floaters and what do they mean? I know in Chinese medicine that we were always taught eye floaters means deficiency. Usually it's a kidney essence deficiency. And you treat it usually with a specific formula and herbs, formula meaning point combination and herbs. I've never seen a lot of success. I'm sorry, blood deficiency. And I've never seen significant, incredible results with that. So tell me about that.
So yeah, floaters can be little. They can be like little annoying, like little things that just kind of go by, or you can have big ones. Like for example, if you have a retinal detachment or a head trauma, or so you have some trauma to your eye. Basically what floaters are, it's dry skin that sloughs off and it floats around the gel, what's called the vitreous of your eye. So some of those, the enzymes in the eye, the body can break them down and get rid of it. The macrophages will do that. If they're too big, and you lack the proteins to get into the eye to break them down, the protease, the lipase, just to break down the cells and the macrophages, it's going to be difficult. Also, dehydration is a huge factor with floaters. Medications can cause it as well. What my favorite nutrient is, there's two things that I really like for dry eyes. We go back to oils, same thing. In Chinese medicine, it's often a liver yin deficiency. Right? That's one of the big classifications.
Okay.
That's oils. That's our thick fluids in Chinese medicine. So we look for a liver blood deficiency. Maybe it's an anemia. Maybe it's a thicker fluid like a yin deficiency, which is more your fats. Your blood is more your blood.
Right.
So we look at glycemic, maybe there's hypoglycemia or blood sugar dysregulation with floaters that can cause that. We also look, again, at dehydration, electrolyte levels, if that's going on systemically. And again, any inflammation going on, allergies. So we look at, again, we're always looking at the zooming out and looking at the whole body, which again is that's the single biggest thing that ophthalmology is failing with a lot of these conditions. Yeah. They're so, pardon the expression, myopic with a lot of these things. They don't see all of these conditions for what they are. They're not looking at the whole body and how these eye conditions relate to the whole body, which is why there's no cure and very poor treatment to them.
Got it.
We understand them in Chinese medicine, functional medicine. So getting back to your question, specifically for floaters, the two things that I like above hydration and increasing like omega-3 DHAs is hyaluronic acid, which are capsules, one of the best things. Also collagen, because a lot of people are low in collagen, and that can cause the structure to start to break down a little bit. We use a lot of, beauty and, skin firming and stuff like that. Same thing with the structure of the eyes. So MSM eye drops is another thing that we use that can be really helpful for that.
Nice. So in closure, I think you've educated me and the audience in an incredible way in a very short period of time. Can you tell people how they can reach out to you and get some of your products?
Yeah. So we have two websites. Our practice website is AcuVision Acupuncture. Dr. Andy Rosenfarb. If you really want to learn more about what I do, I have a YouTube page with enormous amounts of patient education. It's all free. That's also attached to our Eye Health Institute website. Just to educate yourself, like learn about it. One of the biggest things we talked about earlier is screen use. Screen use causes dry eyes. Screen use causes this, it chews up the carotenoid antioxidants and the blue light stress on the eyes. So protect your eyes from UV radiation. The ozone layer is not how it used to be. So, but if you want to reach out to us, you can call our office. Our number's on our website. We also have a Facebook group called Dr. Rosenfarb's AccuVision community. You're welcome to join us there and ask questions about your condition or just kind of hang out and, watch some of our videos and stuff.
Very good. We appreciate it. And I really appreciate it on behalf of my mom that you've helped her tremendously. She doesn't text me every 20 minutes and ask me what to do for dry eye anymore, which is great. And
yeah,
we may have you come back and talk about some other detailed things on vision issues.
Absolutely.
Problems. Thank you so much.
Thank you, Tammy.